This next procedure was performed this past week on a wonderful lady with Fuchs corneal dystrophy, a visually significant cataract. You can see she also has a Salzmann's nodule here that I'm lifting, excising, much like a pterygium. But I'm about to excise this Salzmann's nodule that she has. Also, she's monocular, so she's been fairly anxious over the past 8 months in anticipation of this procedure. It's being done under topical anesthesia with some sedation. I'm going ahead and using the area of the Salzmann's nodule here for my initial incision, performing capsulorhexis here. I'm wondering if maybe I should have done the nodule after this. As I can see, it's kind of affecting my visibility a little bit. So I'm just being very careful here, removing the anterior lens capsule to create access to the nuclear sclerotic cataract. You can see I'm making a continuous curvilinear capsulorhexis that allow us to use a foldable modern style intraocular lens. Hydrodissection here. This is for cleaving the cortex and lens material from the capsule. Also tends to reduce the risk of developing opacification later. Removing the lens here, the cataract, by phacoemulsification. The technique here is a carousel technique. I wouldn't use this technique in a patient with Fuchs dystrophy if I wasn't also removing the endothelium and doing the combination DSAEK corneal transplant procedure. But the carousel technique is very effective, very efficient with a dense lens here, knowing in advance that I'm going to also be managing the Fuchs corneal dystrophy. So I'm removing the lens nucleus, the epinucleus, and very shortly I'll be going after the lens cortex. Here I'm aspirating the lens cortical material, trying to slow down the development of posterior capsular opacification by doing a very thorough removal of lens cortex, frequently checking in with the patient, making sure she's comfortable, and she's telling me that she's very relaxed, very comfortable, and so it turns out things are going extremely well here. Removing the last bit of lens cortex. Very careful here as the posterior capsule is very thin. Putting in some cohesive viscoelastic, and I'm injecting the foldable acrylic intraocular lens through a tight incision. You can see the stria that occurred with that. So I'm putting the lens in. I don't worry too much about centration initially. I'm going to do an initial stripping here of Descemet's membrane. I'm using a nucleus manipulator here to strip, and now a Gorovoy stripper to peel back Descemet's membrane, exposing posterior stroma. I'll be using the Carlson insertion forceps shortly, used by some to insert the tissue. I developed these forceps, and I'm using it now primarily for the removal of Descemet's membrane with a decimetorhexis type technique. Allows for also developing a wonderful specimen. I've also developed this inferior peripheral iridectomy technique, which reduces the likelihood that the patient will develop a block type of glaucoma that they can get in the early postoperative period. Removing the viscoelastic here. The nice thing about the cohesive viscoelastic is it's so easy to remove. I'm going to go ahead and prepare the donor tissue here. We have a very terrific, wonderful donor for this patient, and we're going to make sure that it's completely separated from the periphery by removing the trephine. Here I'm going to now separate the tissue. First I'm going to put some protective cohesive viscoelastic on the tissue. I'm separating it and then just sliding it into position. I've got a low flow anterior chamber maintainer, which I've now removed, repositioning the tissue with a Sinskey hook. There's several different successful ways of doing that. It's rare that I use suture, but given this patient's monocular status and the fact that I ended up putting the incision in the area where I removed the Salzmann's nodule. I thought putting a suture in here for a couple of weeks wouldn't be a bad idea as that area heals, particularly as the epithelium migrates over that area that I removed the Salzmann's nodule. And so she did wonderfully.